Hi, Pasha. It's good to see your face. Oh, you're on mute.
I said, same here. Always good to see you.
Thank you, Catherine. All right. Brittany, do we have everyone in the room? I can't tell.
Yes, sorry.
Okay. Welcome, everybody. Sorry, for some reason you're not showing up on my screen today. I'm not sure why. It is very nice to see you. Welcome to the 10th Behavioral Health System Redesign Steering Committee meeting, and our last one of 2023. So before we get started, I want to do my usual tech moment and remind everyone how we use the Zoom tool together. First, I want to thank our ASL interpreters who are joining us today. You can see Catherine on your screen, and Lori will be trading off with Catherine. And all of us will do our best to speak slowly and clearly so that we are having mercy on them and their very challenging job. All right, let's advance the slide, please. All right, so as a reminder, I have two of these slides. One is for steering committee members, and the second one is for our community members and guests. Steering committee members, if you could please leave your mics on mute and your video cameras on, that will help us engage with each other almost as if we were in a room together. If you could click ahead. You can let us know if you want to ask a question or make a comment by raising your hand. You do that by clicking on that reactions button in the lower right corner. It raises a screen, and then click on raise your hand. To advance, please. If you would like to make a comment in written form rather than verbally, please feel free to send me a chat and I can relay the comment. Or if it's something that's just for me that you don't want me to say out loud, you can also just signal to me in the chat that it's just for the record for me. Click ahead, please. And then as a reminder, if you'd like to see all the steering committee members, you can click on that speaker view button and change it to gallery view. Let's advance the slide. All right, and so for our members of the public, if you could also leave your mics on mute for the duration of the meeting, except for when we get to public comment, if you sign up to make a public comment. And I'm going to ask you to leave your video cameras off for the majority of the meeting. Again, the exception will be when we get to public comment. Advance, please. You can change that speaker view to gallery view and see the steering committee members on your screen. All right, let's advance the slide then, please. Okay, so this is a fairly light meeting today. Not light, it's important, but there's not a lot of items packed into our agenda today. Our main purpose today is to approve the 2023 steering committee, or sorry, CRIS Committee, Crisis Response Improvement Strategy Committee Progress Report to the Legislature and the Governor. And then we wanted to use a little time to reflect on the successes and challenges for the CRIS and subcommittees in 2023. And that information that we discussed today will inform the approach for 2024. We'll confirm action items and next steps, and we'll hear public comment. So those are objectives for today. I'm going to quickly run through the agenda, and then we'll do some introductions. So we're doing our tech, or we did our tech review. I'm doing welcome introductions and reviewing our meeting agenda now. And then we'll move into our discussion of the 2023 progress report. After we conclude that and take a vote as a steering committee, we'll move into reflections on 2023. We'll do action items and next steps, and then we'll move into our public comment period at 2:10. And momentarily, I'll remind our community about how we do our public comment period. But first off, Brittany, if you don't mind taking down the slides, I want to mention, some of you may know this, but Carrie Waterland, our wonderful steering committee member from Healthcare Authority, is transitioning. She's leaving HCA and taking a new position at Pierce County Council's Public Safety and Human Services team. And so I would like to introduce Tisha Kirschbaum and Tisha, please correct me if I get this wrong, but Deputy Director of Behavioral Health and Recovery at HCA. And she'll be filling the HCA seat on the steering committee. And Tisha, I hate to put you on the spot, but would you mind just introducing yourself to everyone? I know I didn't bear the lead there, but if there's anything else you want to say about yourself, we'd love to get to know you better.
Thank you. Really appreciate the opportunity to serve on this committee in Carrie's role, and just know the very, very big shoes that I'm stepping into. We're so excited for Carrie in her next adventure, and also so very, very sad that she's leaving. So my name is Tisha Kirschbaum. I am the Deputy Director of Treatment and Recovery Programs at the Division of Behavioral Health and Recovery at the Healthcare Authority. Basically, what that means is I oversee all of our programming and clinical work within the Division of Behavioral Health and Recovery. For the past year or so, I've been really kind of overseeing the team that does a lot of the work at DBHR, or the Division of Behavioral Health and Recovery, connected to 988 and our mobile rapid response crisis team. So I'm really excited to be able to kind of step into this new role with the CRIS Committee. So thank you.
And Tisha, we're so delighted to have you join us. Thank you so much for being part of this committee. In lieu of, I know typically with steering committee meetings, I ask one steering committee member to do the welcome, but this time I would actually just like each of our steering committee members who are present today, if you wouldn't mind just reminding, it's been a little while since we've had a steering committee meeting, so if you wouldn't mind just introducing yourself, reminding everyone who you are, and if there are any words you want to say of welcome to our community, please feel free to say that then. And I'm going to go in the order I'm seeing you on my screen. So I'm going to start with Bipasha. Michelle will be next. And I'm going to look to see who else is here today. So Bipasha.
Hello, everyone. My name is Bipasha. I serve on the CRIS as a person with lived experience and as an extension on the steering committee as well. I'm also a member of the lived experience subcommittee. And this is the first time I'm at a steering committee meeting where I actually get to vote. Thank you to the people in the community that spoke up saying our representative needs to be able to vote. And thank you to Rep. Orwell for adding that to the bill. And here I am. And 2022 was a scary year because I was new to the process. I got a little more comfortable in 23, and I'm looking forward to doing more work, and especially bringing the voices of people with lived experience to everything that this committee talks about and does. Thank you.
Thank you, Bipasha. Michelle.
Oh, sorry, also
Okay.
she, her pronouns. Sorry.
Well, good afternoon, everybody. My name is Michelle Roberts. I also use she, her pronouns, and I serve on this committee representing the Washington State Department of Health, where I serve as the Assistant Secretary for our Prevention and Community Health Division, which is where our 988 team sits, and along with some injury and violence and other prevention work that we do to help support the system. It's great to be back together today and not to look too far ahead towards the topics on the agenda, just with reflecting on this on this last year together and on the report. But I just feel like we've really hit a great stride. And I know there's many people who have contributed to the work we've collectively done together this year. So I'm just really looking forward to talking about it more, and just really thank the broad community for just continuing to engage through really critical and sometimes tough work.
Thank you, Michelle. Dr. Snowden.
Can you hear me?
Yes, I can.
Okay, thanks. Sorry, I'm late joining, but I had the wrong link, I think. So where are we?
Oh, I was inviting steering committee members to just and reintroduce themselves to everyone. And if you want to say a few words of welcome to our community.
Thank you. Yeah, so I'm Mark Snowden. I'm a professor with the Department of Psychiatry, and I'm on the steering committee representing the Behavioral Health Institute at Harborview.
Thank you, Dr. Snowden. And I see you are in a room at UW, which is something we do now too as part of public meeting requirements, so that folks should know there will be a physical place you can go if you ever want to go to observe or participate in any of these meetings. Betsy, I'd love it if you wanted to reintroduce yourself too and say a few words.
Thanks, Jamie. Hi, everyone. I'm Betsy Jones with Health Management Associates, and I am leading the great team that's behind the scenes and in front of the camera as well, facilitating the 1477 advisory process. And we've been at this for almost a couple of years now. So welcome, everyone, and thanks for joining this last meeting of 2023.
Thanks, Betsy. And I know Representative Orwell is planning to be here today. I don't see her on yet, so she might be running late. So I think we'll just go ahead with the agenda. Folks, we will have a public comment period as we always do in the last 20 minutes of our meeting. So if you would like to make a public comment today, please send a chat to Brittany Thompson. And when we get to that time in our agenda, which could be earlier than it's listed on the agenda, just because we have a few steering committee members who are already on their annual leave. And so it could be a quicker meeting than it says on the agenda, no promises. So just be prepared for that. But if you would like to make a public comment today, please send a chat to Brittany Thompson. She'll take your name down. I will at that time call your name in the order in which we receive it in the chat. And you will have 2 minutes to make a comment. I will put a timer up on the screen. I'm going to ask you to observe that time and wrap up your comment when the 2 minutes are up. If we get a lot of requests for comment today, I might shrink that to 90 seconds, but it's been a while since we've had to do that. So I'm not anticipating that's a likely scenario. Just a reminder that our steering committee members will not be responding to comments. They will be listening, but they will not be responding. And if you would like to make a comment, but you prefer not to do it on camera or in a verbal way, you are very welcome to write up your comment and send it to the project email box. And we'll put that in the chat momentarily so that you have that. Those comments also get sent to our steering committee and CRIS committee, and no one way is weighted more or more important than the other. All right, let's move into our discussion of the 2023 progress report. And to kick it off, Nicola is going to share with you kind of a summary of how we got to where we are today to have you ask you to approve the report and a summary of the comments that she received that were resolved in this latest version that we're asking you to approve. So I'm going to turn it over to Nicola.
Thank you, Jamie. Brittany, could you share the slides again and just moving into slide 7? Great, thank you. So before I give an overview of the comments received on the final draft report, just wanted to provide a brief refresher on the process that we engaged to develop this year's report. So this is just an overview of the last 4 months, and to give you at a high level some of the key steps that we've engaged in gathering feedback and developing the recommendations in this year's report. So you can see here on the far left, we have here highlighted in the green box the work that we did this year to develop what we called synthesis documents for each part of the crisis service continuum. So focused on a place to call, someone to come, and a safe place to be. And we developed those documents based on committee discussions throughout 2023 and gathered feedback from CRIS members as well as subcommittee members into those synthesis documents, where we highlighted in those documents key system gaps, progress made by the legislature and state agencies to address those gaps, and then continuing opportunities to continue to build on the work that has been done and to continue to improve the system. So we use those synthesis documents to identify a number of recommendations that the CRIS Committee at its in-person meeting on September 19th reviewed and discussed the recommendations and priorities that members had for this year's report. So out of that discussion, then we took that list of recommendations and further synthesize those recommendations, as there were areas where we could group like topics as well as consolidate recommendations into, where there were duplicate topics and areas addressed. So we worked to do that throughout October to develop the draft committee recommendations and progress report. And out of that work, we brought forward on November 7th at the CRIS meeting, a synthesis of recommendations that we discussed at the CRIS, where we consolidated into a list that you see in this year's report of 18 core recommendations. We then we gathered feedback at that CRIS meeting and further incorporated that into the draft committee progress report that the CRIS and tribal partners received in November for providing comments and feedback. And so that report was available for review and comments November 15th through December 4th. And today we will highlight for you some of the final comments and feedback received on the report that we've integrated. Also wanted to highlight here that we've taken the report through a tribal consultation process. And this year that's involved a tribal roundtable meeting with tribal partners that occurred on November 29th, and a tribal consultation meeting that occurred last week on December 13th. And at that meeting, we gathered tribal feedback on the final draft report, and I can review some of the final comments provided at those meetings. So today then, that brings us to December 18th, and we are here to give a final review of the comments received and the final report so that we can prepare a final report for submission to the governor and legislature this year. So I will now turn to give you a high-level overview of some of the final comments received. And Brittany, if you wouldn't mind, I can share my screen on these comments so that I can just scroll through myself. One moment. Okay. So I'm sharing my screen with the final comments received on the report, just to give you a high-level overview of the comments received and how they were addressed. This went out with the final report that we shared with you all last week, and reflects the sort of final changes that are included in the report. But just gives you this high-level overview of those changes and how the comments and how we address those in the report. So you can see here there were several changes. There were a number of comments identified during the tribal roundtable, and we actually added one final comment that was received during the tribal consultation meeting last Wednesday. Overall, though, before jumping into these comments, we received overall support for the report from tribal partners and appreciation for the extent to which tribal priorities are reflected and integrated throughout the report. So here, highlighting just a couple of final issues that the tribes noted during the roundtable and consultation. One was highlighting the need to recognize hospitals as part of the cross-system coordination as part of the cross-system partners in coordination of the crisis response. And so We added to the report hospitals as part of the recommendation number 15 related to cross-system coordination. And in addition, language highlighting the importance that tribal partners had identified in coordinating with hospitals, particularly in ensuring that there are systems to make sure that tribal members in crisis are connected with Indian healthcare providers and tribal resources. In addition, there was a request to include Native and Strong Lifeline data in the report and examples of success. We did that. We included a link to the Native Resource Hub and the Native and Strong Lifeline in the report. We included also a highlight for working with tribal partners in 2024 around recommendation 11, which is focused on work around system oversight and performance. The tribes also identified a request for additional tribal representatives, and we identified here plans to work with the American Indian Health Commission and the Healthcare Authority to ensure tribal representation on the CRIS next year. And then finally, we have here a comment received last week on emphasizing the need for a payer blind system, particularly for tribal members who are covered through the Medicaid fee-for-service system, but who may encounter barriers when they seek coverage by providers or seek access to services by providers who don't accept Medicaid fee-for-service. And there's a need for coverage through Medicaid managed care, which they're entitled to, but particularly when they're seeking coverage, as you all know, this is, time-sensitive access, and ensuring that there is sort of seamless access to these services regardless of payer type. So that's an overview of some of the tribal feedback that we received and how those comments were addressed. We also have highlighted here comments received by CRIS members. Michael Robertson emphasized the importance of looking at substance use disorder as a hugely contributing factor to behavioral health crisis. And so we identified in the report both sort of a place under recommendation number 17 to emphasize in the workforce training the need to understand the prevalence and effects of substance use disorders in behavioral health crisis, and responding in a manner that is culturally appropriate and centered in equity. We also clarified just throughout the report, there have been reference already to the importance of recognizing substance use disorders, but clarifying both the need to ensure system capacity for people with co-occurring disorders, as well as people with a standalone, sort of a mental health and or a substance use disorder. So issues that may just be occurring independently. Kashi Arora emphasized some of the important recommendations related to children in the crisis response system. Under recommendation 9, which related to the services, under recommendations related to crisis system services and a safe place to be, we added language explicitly addressing a recommendation for expanding crisis relief centers under that have been established this year under Senate Bill 5120 to serve youth. And this is a recommendation that aligns with a 2024 legislative priority coming out of the Children, Youth, and Behavioral Health Work Group. In addition, Kashi emphasized the importance of ensuring system capacity and system plans for identifying youth callers to 988. And this language is highlighted in the report already, and we just highlighted it here again. in terms of where this is recognized in the report. And then finally, Kim Molsoff provided comment and had emphasized again the issue relating to individuals who may lack insight into their condition and the relationship to informed consent. And so in the report, there is a statement under recommendation 2 relating to the Color Bill of Rights. And there's a reference there where committee members emphasize the importance of informed consent in the system, while also considering circumstances in which consent may not be possible, such as individuals who lack insight into their condition. And so this recommendation, we did not make any further changes to this recommendation as it reflects the perspectives and comments that have been made by committee members throughout this year. So we've just noted that here in this summary of comments. So that's an overview of the final comments made to the report from the drafts that you all have seen, and wanted to just provide that overview today so that you have a brief understanding of the final changes made to the report.
Thanks, Nicola. So as you gathered from what Nicola said, the comments were relatively minor in terms of the extent to which major edits were required to this latest version that was sent out for review. And as she also mentioned, we revised our process this year to do more to bring everyone along and have lots of touch points so that by the time we got to this stage, there would be very few, if any, surprises for people in the document. All of the feedback that CRIS committee members and subcommittees were providing was incorporated along the way. That was the intent and how it appeared to have played out. So I'm hopeful that our conclusion that CRIS committee members and subcommittee members are on the whole satisfied with this report makes it easier for you to do your job, steering committee, today and approve this report for submittal to the legislature and the governor. So as is our practice, I'm going to, first of all, invite you to ask any questions or make any comments, and then we're going to invite voting members, including our newest voting member, Well, actually, Bipasha, you're not our newest voting member today. Tisha's our newest voting member today, but that's okay. This is your first one where you get to vote too. But we will make a vote to approve this report to be submitted after we give you all a moment to ask questions or offer any final comments. So, steering committee members, any questions? Dr. Snowden.
Thanks, Jamie. I think the response to the edits and questions and concerns has been great. I think the only thing I would highlight, lest it seem like we didn't make any adjustments, is to that last item that was number 10 that had been raised by Kim Molsoff about insight. What I just would remind is that we actually did change it from what was in the original draft recommendations based on her concerns. We've removed the reference to the actual formal term of anosognosia because it's too jargony and too technical. We've also clarified, as she pointed out, that it is not a diagnosis in the Diagnostic and Statistical Manual. What Nicola, I think, was referring to is after those changes, she had another comment, and it was that last comment that we felt we couldn't make any more changes to. And I think I support that.
Thanks for that clarification, Dr. Snowden. I think that's really helpful for everybody to understand the path there. Representative Orwell.
Thank you. I just have to first comment that it is so clear that so much work has been done. And I just really want to applaud CRIS and the staff, because it was a huge workload and a lot of moving parts of all these committees. And I really am really proud of the work that's been done. I think the report is very well done. You know, some of the things that really I really appreciated seeing was around the equity and trying to diversify the workforce. And there is that recommendation for a director of equity and inclusion. I do support that. I do wonder how that will work with the Department of Equity we have at the state level. But again, I think that's really exciting and something to explore. And that certainly could be a legislative action we can work on this session. I really just was so struck about the great work the tribes have done and in collaboration with the state. It's just really impressive. Our state should be so proud of this work. And one of the things that's being requested is to include the text and chat as part of the Native and Strong, and certainly want to help seek out funding for that. Also, the coordination. And when I was looking at all the work, I'm trying to remember the title of it's like the co-responders and community and all that coordination, but really saying, how do we bring communities of color together with first responders and behavioral health to really look at what the barriers are to 988 and accessing services, as well as the Caller Bill of Rights. So there's so many good things in this report. The other thing I would say, and I know Senator Dinger cannot be here today, and I know she is addressing the receiving centers in the legislation this year, which is great. The one thing that struck me when I reread the report is there's a graphic that talks about where to call, and it says 988 RCL. And I feel like that's a little confusing message to the legislature, and not that the RCLs don't have a continued role, you know, but so anyway, that's the only thing I saw that again. And I thought, well, maybe we have more work to do in that arena too, of how we clarify our system, because again, I think to the public and the legislature, we want it to be, you know, this really kind of easy to access service. But I just want to say overall, I'm just incredibly impressed, and certainly hope we can move some of these things forward this session.
Thank you, Representative Orwell. So I just want to make sure I'm tracking it sounds like you're calling out that graphic as maybe a place where we could put some more work into thinking about how we communicate about how the system works, but it's not necessarily needs to be changed for this moment, or?
Well, it feels like in the body of the report, you talk about that work, right? And you have the work group, but I think it's not showing that vision around 988 being the place to call, right? And this is the 988 report, because, you know, 5-10 years, it's probably gonna be 988, 911, 211. And I just think maybe that's a confusing graphic of where we're headed for a 988 report, is to list both. But that's my opinion. Others may have a different opinion.
Nicola, Betsy, any response to that, or does that?
Well, yes, Rep. Orwell, really appreciate your comment. And I think the goal is to get to more clarity. And I know, as you do, that there's work going on with HCA and DOH and the RCL folks and 988 call centers to answer this question. And until something has been solidified, and I know that's coming very shortly, I would be reluctant to change the report, because it really does reflect the current state. But I'm not a voting member here, so I leave it to you all to determine what, if anything, you want to change about the way that the report is for 2023.
Okay, I'll take Bipasha, and then I might just circle back to this to make sure we're closing it out. Bipasha.
So I just wanted to first say thank you for the step-by-step build-up to the report. It was really helpful, you know, to kind of follow along, and definitely the final report is much more easy to read. Sorry, something's echoing. The other thing I wanted to ask a clarifying question. When you all summarized in the report about the subcommittee meetings, there was no mention of the cross-system, the credentialing, and the confidential information subcommittee meetings. So I was not sure if they just didn't meet, because it's still important ongoing work that needs to be part of the 988 system, Betsy.
Yeah, Bipasha, you're correct. Those subcommittees did not meet in 2023. We focused in other areas. That said, we do have a plan for reigniting those subcommittee meetings in 2024, with the exception of confidential information. I think we're planning to address it, but more in the context of the geolocation subcommittee that's being stood up. So good call out, Bipasha. And yes, for those of you who are on those subcommittees, we have not forgotten about you, and we'll be reinvigorating those conversations in 24.
And the two other points I wanted to add is that, in talking with Michael Robertson, who is a lived experience person on the CRIS, we have realized that we're really not addressing the fentanyl epidemic and that's going on. We really haven't given it the weight it needs, given the impact it's having on the community. So we do need to take that on, which is why Michael submitted that comment. And the issue of anosognosia and where we draw the line, that is a repeated topic that keeps coming up. And I'm sure Nicola and Betsy, you'll attend our subcommittee meetings. It keeps coming up, and I feel this topic needs a deeper dive. We really need to involve Kim. We need to involve the DCRs. We need to involve people who know the system, and so we can flesh out better where those lines lie. I think we really need to take a look at the DCR standards of hospitalization and listen to, and honestly, it's a very tricky space because we have lived experience in our subcommittee. We have both families and loved ones, and we have people who are directly lived experience. And I keep saying, if we cannot have that dialogue, I think the system will never be able to step up to meet us. So I'm hoping next year we delve deeper into this very sensitive topic with great respect and regard for all parties, but we can flesh out more of that piece where people step in. So I just wanted to let you all know that came directly from the lived experience subcommittee conversations. Thank you.
Thank you, Bipasha, for flagging that. And we'll do a little more conversation about reflections on this year and how that might inform what we think about next year momentarily. So I'm going to go to Michelle now.
Well, I just want to start by saying thank you to, the process, which you kind of, I don't know, was it you, Jamie, or Nicola gave an overview? I guess Nicola, you did, but can't even remember what happened 10 minutes ago. But I just feel like the process we went through this year really got us to such a strong point right now, where everybody, I feel like, has had wide opportunities to be involved and to give input. And I think it's really clear from the work we did together in person and on kind of outlining the things was step-by-step fashion to where we got to the recommendation. So just really appreciate the work. And I think it was last couple of years have been a little bit bumpy as we figured out how to do this large amount of work. And it feels like this year we really excelled at bringing everybody together. So I know that's a lot of hard work, especially to Betsy and Nicola and your teams, keeping us moving behind the scenes. I think the report overall looks really, really good. I just appreciate the incredible deep pieces on equity and, making sure the input from our lived experience committee is really clear, and we continue to work on that. So I think that's just at the heart of why we're doing this work together and what we need to do for system improvement. So I thank you for that. On Rep. Orwell's question about the mention of the crisis lines, is that in more than one place, or is it just on that page 8 in the beginning? And if it's just on that page 8 in the beginning, I think it's talking about, in a section talking about DOH's and HCA's current roles. And so then I think it is right to have both of them for now, because that is a reflection of where the system is now. But if it's the visioning, we could talk about that a little more. But I saw that graphic and initially had the same thought you did, Rep. Orwell.
Right. And I was just referencing the graphic. I didn't have any issues with the text, okay. Michelle. Our marketing 988 this year, and everything we've marketed to the legislature has been about 988 is the place to call. So it almost feels like the graphic is like a step back in time. And it's not that we're not sorting it out and that the text isn't good. It's just the visual the legislature is going to see, and I think it's just going to be a little confusing.
Okay, I want to make sure I'm honing in on is there a recommendation from the steering committee to modify or remove that graphic? Or is this more of a flag for something we might want to work on in 2024?
I guess my request, the steering committee, since it's in the text, is can we just change the graphic? Because I feel like that may be confusing, that we're telling people now call 988 and the RCL line.
Nicola, does that direction seem clear to you, or do you need more feedback from the steering committee on that?
Yeah, I think depending on the will of the steering committee, I think we could adjust the graphic to note just the DOH purview of 988. And I can share my screen so we can look specifically at it. I think.
Yeah, why don't we do that just to make sure everybody's on the same page? Yeah, if you don't mind, that'd be great.
So this is the graphic in the report regarding the continuum, and it falls in this section on working with state agency partners. And we had wanted to give just a high level overview of the purview of the agencies over the different, aspects or pieces of the crisis response continuum. And so, we've got sort of a narrative here above in the paragraph above regarding the role of DOH and HCA, mentioning the 988 centers for DOH here in the narrative, and then HCA referencing the regional crisis lines, as well as the rapid response teams and crisis stabilization. So that's where we've just reflected that here in the graphic. And I think this is the piece, someone to call, where we've got, the regional crisis lines reflected in here with HCA and sort of conveying, in the current system, the work that HCA and DOH are doing to transition that current system. But I will leave it to others in terms of, adjustments to this graphic so that we don't cause confusion around this.
Tisha, do you have a thought on this one?
Yeah, I could see how just leaving the wording in the paragraph up above the narrative, I wouldn't touch any of that. I think it's perfect. And I could see how just striking under somewhere to call where it says HCA regional crisis lines, it probably would make it a little clearer or cleaner. I'd have no concern with it.
Okay, so it sounds like Tisha's proposing that we resolve the feedback that Representative Orwell and echoed by Michelle. We delete that HCA regional crisis lines italics under someone to call, just to avoid confusion. Bipasha, what are your thoughts here?
So I will say part of this comes because people, when lived experience people call, some of them will call 988, but as we know, the system is not yet streamlined, right? So there are certain things they have to be referred to their regional crisis line. So then what people do is, why did I bother calling 988? I might as well just have called the regional crisis line directly. This is where, amongst other spaces, this is coming from. But I also hear what Rep. Orwell is saying. We're trying to grow the 988 system and make it the primary system. So in keeping in mind what I hear from lived experience, I'm okay with the change in the graphic while leaving the text, just so when, saying what everybody said, so that people know. I want people to know in the community that they will get help if they call a regional crisis line. They shouldn't worry about it. But ideally, we want them to call 988 first. But as it stands right now, because of the not very, smooth system yet, people will need to know that it's okay to call. But I think for the graphic purposes, I can understand that it makes more sense to keep it streamlined. Thank you.
Okay, so I'm hearing general agreement around Tisha's suggestion that we keep the text exactly as is, but in the graphic, we remove that one line under someone to call that says HCA regional crisis lines. Do I have that right? Okay, Nicola, does that direction make sense to you as the author?
Thank you. Yes,
Okay.
absolutely.
All right, so any other questions or feedback before we move to a vote? All right, go ahead, Bipasha, yes.
Just, and this is my error because I did not send the feedback, but I felt that the report could do with mentioning peer presence in across the system. It did come across in the somewhere to a safe place to be bucket. But I think we as the lived experience, who are also service providers, some of them are, want to see that peers be present. And by that, I don't necessarily, honestly, I go back to the Arizona model when we went to Maricopa County, where they told us that even psychiatrists, if they have lived experience, some of them openly identify that I'm a person with lived experience, but I'm also the psychiatrist who provides services. So it doesn't necessarily, I think it's a twofold thing. One is obviously to have people who work purely as peers in the system, expand that process. But I think we should try to encourage people at every level of their profession, if their lived experience, to say, I'm a person with lived experience, but I can also function as a person who provides services. This dichotomy, there's so much shame, even from the medical system, of owning your lived experience, and then, your licensing gets impacted. So, but just to have the fact, if not peers, at least lived experience be emphasized across the entire system, that people step up, own it, or there are specialized roles that are filled by people who are certified peers.
Okay, Bipasha, so I'm hearing that, I do want to clarify if you mean that you are proposing a revision to this final report, or if you are suggesting or asking that as we move forward with our future reports and future work together, that we are emphasizing the both peer presence throughout the system and individuals who are working in the system owning their own lived experience and bringing and supporting them in doing that. So just a clarifying question, are you asking for a revision to this report, or are you asking for us to really keep this in mind as we move forward?
I think it's okay. It's the 18th of December. It's fine if this report goes out as it is.
Okay.
It does mention peers, but to next year emphasize that we talk more about embedding peers and lived experience, people stepping up through the entire process. Thanks.
Wonderful. Okay, so let's make a note that that is something that we really want to think about and talk more about and engage in more in 2024. Any other final comments, questions, feedback before we move to a vote? Okay, so as I mentioned, we have a couple of voting members on leave today, Amber Leaders and Senator Dingra, and both, I think, have asked other steering committee members to vote for them by proxy. So Representative Orwell, you're going to be carrying Senator Dingra's vote, is that right? And Michelle, are you handling Amber's? Okay, so so our voting members today are Bipasha, Tisha, Representative Orwell, Michelle Roberts, and then Senator Dingra by proxy and Amber Leaders by proxy. So I'm going to ask you if you could show either by putting up raise your hand or just holding up your hand if you vote to approve this report with the one amendment we talked about, which is removing that language under the graphic that Nicola showed on the screen to the legislature and the governor. And I see hands from Michelle and Representative Orwell. Can I confirm that those are also for Amber and Senator Dingra? Perfect. Thank you. 2 hands. All right. I see one from Bipasha. And I see a hand from Tisha. So that is unanimous approval of this report. Thank you so much. Congratulations. I think Nicola will get to enjoy her Christmas break this year. So that's lovely. And just a huge amount of gratitude to everyone who put so much effort into getting us to this great place, and most especially our CRIS committee and subcommittee members who worked so hard to get us to this place, and Nicola. All right, and that is a lovely way to transition into just some reflections on 2023. We actually asked our steering committee members to give this question some thought before they came today. And so I'm just going to remind everyone on the steering committee what we asked you to think about, which is if you could share, what are your observations about the extent to which the CRIS committee and subcommittee met expectations in 2023? And what were the biggest successes and challenges? And then if you also, or if you'd like to add anything about how the CRIS's work in 2023 has influenced your agency, your legislative priorities, Bipasha, in your case, lived experience subcommittee, and what you want to tackle. And you've already talked a little bit about that, but I want to hear more, or your institutional priorities in 2024. And I'm going to go ahead and put these in the chat since that's a lot and I don't want you to have to memorize it. But bear with me 1 second. I'm going to just copy and paste. All right. So those are our questions. Does anyone want to kick us off? I was hoping you'd raise your hand, Representative Orwell.
No, I'd be happy to start. And again, I just think a tremendous amount of work has been done. Some of the things that jumped out to me, one is it felt like there was a better job really incorporating the lived experience voice into all the work. And I attended some of those meetings, and boy, the questions and the dialogue was so powerful. So to me, that was a real strength of this year's. It seems so much more prominent. And I also really appreciate the focus again on the diversity and equity, and with some real concrete ways of moving those things forward. And so those really jumped out for me. I also was just fascinated with the Bill of Rights. And because when we were getting feedback from people calling 988, I think people were having a lot of great experiences, but we're hearing some that aren't great. And, you know, maybe there's a way of really understanding and educating the public of what to expect and how we can make it better. So those were some of my kind of takeaways. Clearly, this session, this work influenced what we're doing, Senator Dinger and I, and we're really going to try to honor and support as much as we can that actually requires legislative action. A lot of it does not. So there's not any big 98 bills. There probably might be a couple small ones. But again, I just really proud of the work and just how we're building on it. I love the idea of the tribes having more resources and a greater participation and more integrated into our process. So again, really impressed and really excited for next year.
Thanks for kicking us off, Representative Orwell. Dr. Snowden.
Thanks, Jamie. I made a few notes that I'll go through. I believe the top success in my mind is the great work that we had with the Crisis and First Responder Collaboration Work Group. As I think about the hardest places the CRIS has been, the hardest discussions, it all centered around the tension between how do we change the system to minimize the involvement of specifically law enforcement while still recognizing that the involvement of law enforcement will be necessary. And the work of that collaborative work group far exceeded my expectations. I thought at best we would come out with a stalemate where we were simply having all sides continuing to struggle. But in fact, they came out with I think, a very thoughtful statement of principles that acknowledge that this is really not about if this is going to happen, because it will happen. And so we're really trying to make it better. And I think that really got us out of a stuck place and into a place where we could actually start to make progress and think about how can we improve the system without people feeling like they are just entrenched defending the positions that they feel need to be defended. So to me, that was a huge success. As I think about things that I think are still challenges, it struck me in reading the comments from particularly the tribal leadership that there is this process issue that we have where in respect of the sovereignty of the tribes, they don't necessarily participate in full force, in my view, with the CRIS. But it was very clear that the input that we got on the draft recommendations made the report a whole lot better. And so I would love to see us figure out a way to keep that consultative aspect of tribal leadership, but also infuse more input into the CRIS process as well. So that we're not always having to wait until we get to a review of report status. That leads me into the next challenge, which is the CRIS is a very large committee, and I think we still struggle to figure out how to truly best capitalize and capture the input of its members. I think we've got a few members that are very active and very comfortable speaking out. But I also think we've got a lot of members who I'm not sure what they're always thinking as I sit as a steering committee member. And so I think our challenge is still to figure out how can we best tailor our processes to get more input from that wealth of expertise that the CRIS really does represent. In terms of work going forward, my belief is that we're going to have to prioritize at some point. We're getting lots and lots of recommendations, and at some point we may have to think about priorities and places to start because we won't be able to do it all at once. The last thing is, it's more of a specific thing in the report that I saw, is a lot of our recommendations are focusing on training. And while I'm a big believer in training and education, I don't think training is a substitute for resource. And I think it's easy to say we can fund training, we can mandate training, but if the real issue is we don't have a resource, we don't have the workforce, training the people we do have doesn't get us over that hurdle. And so I don't want us to start having unrealistic expectations of how far training as an intervention, so to speak, will actually get us.
Dr. Snowden, thanks so much for all the thought you give to your comments. I mean, I don't want to step out of my lane as facilitator, but I feel like a lot of those are really spot on. So you mentioned the very successful outcomes from the first responder collaboration. You also mentioned that the tribal input was really important to the report and really made it stronger, but it would be good for us to look at how we're engaging with and consulting with tribes so that it's more along the way as opposed to kind of all at once at the end. You talked about continuing to refine how we work together so that we're making sure we're engaging and leveraging all of the expertise on the CRIS, not just the most vocal members. So I appreciate you sharing all of that. And let's see, other feedback from steering committee members. Pasha.
So yeah, I'm going to echo everything that Rep. Orwell and Dr. Snowden said. Thank you that we had two people on each of those work groups from lived experience. I think that voice really made a difference. In terms of from the lived experience perspective, in 2022, we met about maybe 7 or 8 times, but this year we intentionally met every month of the year, and we're really proud of that because that requires a lot of work. And I wanted to especially thank HMA because we have our planning meetings before we have our actual community meetings. So thank you for the support. We can't do this work without all the support they bring to the table. I think in terms of, we definitely we're able to connect the community because I want to thank HCA and DOH for being there at all our meetings. And also Rep. Orwell, you've attended a bunch because I think as from my perspective, it's like as few people as we can have in between, the community can get their voices directly to the people who can actually affect the system. And that is one of our goals. So I really wanted to appreciate HCA and DOH and everyone who has any power that shows up and listens and tries to incorporate that into the system build out. In terms of challenges, we are still kind of like still having a meeting where we're asking people to come to us And I don't know how and what if we can put our heads together and figure out how do we, as the lived experience that is serving on the CRIS, get out into the communities that do not necessarily have the time, the ability, the know-all, the wherewithal to show up, but be it we have some rural voices, but I would love to hear more rural agro voices. We don't have youth showing up. It's a really awkward time to have youth show up at these meetings. And we are certainly, I'm not sure, tapping into a lot of the various immigrant communities in our state here that can, tell us about how the system can be better. The other challenges we hear, as Rep. Orwell, you said some stories that are difficult to kind of bear witness to. People who've been on wait for a long time, keep getting bounced around in the system. And I really feel like we need to do better at figuring out where the system is relative to where we want it to be, because we need to constantly inform the community where the system is, while keeping the hope alive and the work alive to get it to where it needs to be. So that, because if one of our worries is if 988, because of not the even flow right now, that people might call 988 and say, well, this is not working, and so how do we find that balance between 988, yes, it's not working. I think it's always best to acknowledge truth when people have a lived experience, to say, hey, I agree, it's not working, and not to sort of gaslight them and say, we don't know what, and we're hearing you, this is what we need to shift. But the goal is always to keep the goal in mind of we're trying to get here, and it might take months, it might take a few years, but that balance between hope versus acknowledging reality, I think that continues to be a little bit of a kind of challenge of how do we address that. And when I say us, I mean all of us, especially the steering committee and the spaces you'll occupy in your, places of work. So thank you.
Wise words indeed, Bipasha. And I'm just reflecting on the conversation we had previously about the report and the graphic, and that tension that you raised about how we talk about the moment now and where we want to be, and both being clear but avoiding confusion. So thank you for raising that. Thank you also for talking about our continued work that we need to do to bring more voices directly to this process and minimize the number of intermediaries. And I also want to go back to Dr. Snowden's comment, because he said something else that I did not echo, and I want to make sure it does get captured, which is the importance of starting to really prioritize and sequence all of the recommendations that the CRIS and subcommittees have generated, so that we can actually start to really take action on them. Michelle.
Well, I'll just echo the wisdom, or the comments on the wisdom of the other steering committee members. I really wholeheartedly agree with all the pieces they pointed out, and they were some of the things that are part of my reflections, especially just continue to really, I'm so thankful for the incredible engagement of the Lived Experience Committee, and seeing it show up in more places and in more places in the report and in the recommendations. I think ultimately continuing to build trust and figuring out where are those places the system's not working, and who are the groups of the people that it's not working for, and what do we need to do to address it. When I think this goes back to some of the comments too about the fentanyl crisis and epidemic and many other pieces, but around there is some really complex situations that are happening every day in our communities. There is a lot of deep need. There's a lot of deep distrust that we need to keep breaking down. And I saw that play out again and again throughout as we did our work this year, that we're working to try to do those and tackle those hard challenges together. So just really happy about that. I really appreciate all the lived experience and other and our CRIS input, CRIS member input, other CRIS member input as well, into a couple of big things that the department's working on this year, including the 988 campaign, and super excited to see that launching. Start kind of soft launching later in January, but that's been incredible and aligned with all of our goals. But I think there's been a lot of deep input and helping us chart the pathway there now, when we're at the great place to be ready to launch that. I'm also really thankful for the user experience input that both can help us improve services and work with the current contact centers and call centers to improve services now, but also thinking about what does that mean for the future? What does it mean for the technology we need to develop behind the scenes to support people's experience? And so just thanks for everybody for helping us in Healthcare Authority on trying to figure out our requirements around technology in a way that's going to make sure we've centered community and are addressing what the needs are.
Thank you, Michelle. And I'm kind of hearing a common theme here, which is in terms of where we can celebrate CRIS's successes. There's been a lot of advancing towards centering community and centering lived experience in the work that this group's doing. And there's still lots more to be done, including having a more expansive view of that community and bringing in different voices than what's been in so far, or making sure the voices that are supposed to be at the table are actually being brought in and heard. Tisha, I know you're diving into this process right now with us. Is there any questions you have or any observations that you want to share? I want to make sure I give you the floor, but definitely don't want to put you on the spot since you're drinking from a fire hose right now.
Yeah, well, no, thank you for the opportunity. Mostly just wanted to say it's been fun to see or experience I think specifically our two agencies. I'm specifically talking about the Department of Health, how closely our teams work together, and just the different staff members really watch their relationships and the partnership and the collaboration grow. So that has been exciting over the past few months to watch that. I would say that I think this work of 988 and the CRIS Committee does seep into all parts of the Division of Behavioral Health and Recovery. We often, some of the comments and feedbacks and what we've learned, or what staff have heard from the Lived Experience Subcommittee does get brought up in our leadership conversations on an ongoing basis. So thank you. So just know that we do hear you and those experiences, even if we're not in the room. Staff do a great job of channeling that information up and ensuring that those perspectives are always taken into account as we think about how do we move forward.
I think that's always good to hear, Tisha. So thank you so much for reminding all of us that this work is absolutely going somewhere and people at HCA are using it for their discussions.
Thank you.
I do want to just let people know, because I imagine some people are watching the time and maybe getting concerned. We have not had any signups for public comment today. So I'm going to just continue this discussion a little bit longer. And Brittany will let me know if she gets any signups. But for now, I think we can continue to do these reflections for a few more minutes. Pasha.
I just also wanted to emphasize one thing. At our lived experience meetings, we request people, especially if they're presenting, to say if they are lived experience to whatever degree they are comfortable, and if they're not, in some way to identify with why they do work in behavioral health, because I think there's always a story. And I want to tip my hat to the staff from DOH and HCA, and they come to the table and they're so open about their own lived experience. And I can tell you from my perspective and the perspective of many of us, it does not in any way taint our image of the work they do. If anything, we feel more encouraged that the work they will do will be deeper and better informed because of their lived experience. And that to me is literally symbolizes people who work in the field, who can own up, without any big penalty in their lives to their lived experience. It makes the trust easier to say, oh, you have that diagnosis, or you dealt with a family member. You can understand what I'm saying from a different, but they bring so much vulnerability and so openly share theirs. I just want to say thank you to your staff from DOH and HCA for doing that. I really appreciate it. Thank you.
A lovely message, Pasha. Thank you. I want to give Betsy a moment too to share some reflections. Betsy?
Thanks, Jamie. I really appreciate all these comments and agree that we had a very strong process this year, a very engaged process. I want to just reflect that this has been a collaboration very much across the CRIS, the steering committee, all of the subcommittees, the First Responder Behavioral Health Crisis Collaboration Work Group. It was not adversarial. I think none of us knew what the tone and tenor of the conversation was going to be, but there was so much goodwill and grace in that room over the course of these meetings. I was really proud of us in Washington that we could have these hard conversations and come out with some real agreements and consensus about moving forward and doing the least amount of harm, right, in the implementation work. Want to call out Lived Experience Subcommittee, and I want to call out the planning group this year. Bipasha, you demonstrated leadership with Puck, with Michael, with Kristen, really bringing forward and raising up the voices of lived experience members and the community at large. You were tenacious. So I just, many thanks to you for making HMA's job easier as we went forward. And also to state agency staff. They're experiencing workforce shortages in some cases, and to members of the public, HMA met with the state agency folks, with Gov's office, with leadership on a weekly basis, and sometimes more than that, many times more than weekly. And we just got so much great work done. So just a shout out to everyone for lifting this up and making this year really productive. Oh, and finally, I want to say that, Jamie, I think you said something about the having more voice for the tribes throughout the process. And I want to just correct the record a bit to say that we participated all throughout the year on the Tribal Centric Behavioral Health Advisory Board, and worked with Lucy Mendoza, another superstar, to bring content as we did with the CRIS. We came to every meeting and had conversations and got feedback. So it was very much an iterative process with the tribes as well. I think in 24, we'd be very interested in having more of those voices on the CRIS. And I believe that was Dr. Snowden's point specifically. So thank you.
Betsy, thank you so much for correcting that and for clarifying, because I knew that too. So I apologize for misrepresenting that, but that's exactly right, that
Yeah.
you've been doing that iterative work all year. So Representative Orwell.
Betsy, that was really well said. And just to have to say one more thank you when we talk about 988, which is really our call centers. And not only have they done extraordinary work, of this huge expansion, but they've also been participating in this process, and they're a key part, right? And they come to the table, they're so receptive to feedback and how we move forward. The two things I would say is recently we had a meeting in Vancouver. It included folks from Oregon, and they're like, how can we have the Native and Strong line in Oregon? So again, I think it's just a national model. The other thing is I went to see Sound 911 that has the VOA on site. And I think since July, they've been able to transfer 400 calls to 988 and really are working in a partnership. So again, I think there's just so many exciting things, and I just appreciate the report capturing everyone at the table working together on this.
Michelle.
One other thing, thinking forward to 2024, and I think some of this was reflected in the comments and in the report we've talked about earlier, but just the continued focus on youth and figuring out about, I feel like we've made, are in a good process, and really obviously appreciate the wisdom of Kashi Aurora from the Seattle Children's as a CRIS member, and making the link to work we do collectively around the children at the state level with the Children and Youth Behavioral Health Work Group, creating alignment. But also, I think Kashi was a key in helping Tisha and my staff figure out path forward too around youth and start talking some of the same language a little bit more and figuring out to focus on how do we navigate to make things work for youth and where do we have opportunities. And I think there's a lot of good synergy starting. And I think that's one of the things I'm excited to see continue to play out in 2024.
Great, thank you, Michelle. Any other final comments from the steering committee? Okay, just want to share a comment I just received from Vipasha. Kashi rocks. Vipasha, I agree with you 100%. She does. Brittany, do you mind putting the slides up again? I think we had a couple things in the action item slide just to remind everyone. All right, so action items and next steps. So HMA is going to integrate final changes to the report, specifically that agreement to take out the text in the graphic on page 8 that we talked about HCA and regional crisis lines, and then submit the final committee progress report to the governor and legislature. And then HMA is to send calendar invites for 2024 CRIS and steering committee meetings so that you have those in your calendar for the whole year, hopefully. Any other action items or next steps that I missed? Vipasha.
Can I just say we have an open position on the CRIS for lived experience. So I just want to bring it up and say that the sooner we can fill it, the better it would be for the CRIS as well. So whatever work needs to be done in the background to get that done, I would appreciate.
And as a reminder, everyone, HCA handles the appointments to the CRIS committee. So I believe that's on HCA's radar. Tisha, anything to note about that, or is that did I say anything incorrect there?
I think you got that right.
Okay, excellent. Thank you. Representative Orwell.
Yes, I just was going to say Senator Dinker and I will have some legislation that pertains to 988 in this committee. So if there's any way of keeping the members informed on that, that would be great.
Probably Representative Orwell, there's two good methods. One can be our first one of the year. We can set aside time for you to do a briefing on that. And the other is the newsletter that goes out prior. So why don't we plan on that? All right. Well, with that, Brittany, just confirming, did we get any signups for public comment today?
No signups.
No signups. Okay. Well, then everybody,
Jamie,
yes,
I just want to thank you for your facilitation this year. We've thanked
Oh.
everyone else. Jamie, you're a superstar, and we could not have done it without you. So
thank
many
you.
thanks to you. I'm sure everyone on the steering committee. Yes, thank you. Thank you, Jamie.
That is a lovely, lovely way to send me off on my break. So thank you for that. I appreciate it. And I appreciate each and every one of you. It has been an absolute pleasure and delight to work with you this year. And I'm glad we get another year together. And with that, I just want to say a big, big thank you to our community for all of your support this year and for showing up for these meetings and for participating on subcommittees and just helping us get to this place. I feel like we've just built some great momentum. I'm really looking forward to 2024 and all that can be done. And for now, I wish all of you very happy holidays, whatever and however you celebrate. And I look forward to seeing you in 2024. Take care, everybody.
Happy holidays, everybody. Bye-bye.
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 Bye-bye.